The colon is also known as the large intestine. The colon and the rectum are the final portions of the digestive system. Foods that don't get digested and absorbed in the stomach are usually passed down into the colon, that is the large intestine, and then finally to the rectum. The large intestine basically or primarily acts as a storage facility for waste. Now, cancer occurs when there is a mistake in the replacement process of cells. Usually, our body cells wear out and die, and the body is wired to replace these cells. But sometimes there could be a mistake in this replacement process. Now, when those cells that have mistakes begin to multiply uncontrollably, they could form a tumor, and some of these tumors are cancerous. So basically, colon cancer is when these mistakes happen in the cells of the colon, that is the cells of the large intestine. Then they begin to multiply uncontrollably. The cancerous cells begin to multiply uncontrollably, causing colon cancer or colorectal cancer, that is the colon and the rectum. Colorectal cancer is the third deadliest cancer in the United States today. That is after lung and prostate cancer in men and lung and breast cancer in women. Researchers say that colorectal cancer is getting more popular among younger people today, that half of all new diagnoses are in people who are less than 66 years of age.
So a risk factor is anything that increases one's chance of getting a disease. For instance, risk factors of cancer is anything that increases one's chance of getting the disease cancer. And we'll be talking about two groups: those that can be influenced or you can change, and those that cannot be changed. So for the first group, we have smoking. So high tobacco usage can increase one's chance of getting colon cancer. We also have alcohol usage. Heavy usage of alcohol intake can increase your chances of getting colon cancer. And then your diet. Colon cancer, it's a cancer that affects the large intestine, so your diet is very important. So taking low fiber diet and a diet that is high in fats like red meat can increase your chances of getting colon cancer. Also, we have your lifestyle. Sedentary lifestyle could also affect your chances of getting cancer, which is sedentary lifestyle. That's a lifestyle that you have little or no physical activity. You don't go for any exercise like walking or running. And finally, we have obesity. That's being overweight can affect can be a risk factor of cancer. Then those factors that cannot be changed include your age. So we know colon cancer is very common among people above the age of 50, although there are situations where there's an increase in those a bit lower than 50, but it's very common among adults above 50. Then we have race. It's research has shown that African Americans have higher chances compared to other race when it comes to colon cancer. Then ulcerative colitis is also a risk factor. That's inflammation of the large intestines or your bowel. So if you have had an inflammation there, it's also a risk factor. Then we have inherited gene. So it's possible to inherit this mutated gene from maybe your ancestors or even your parents. Then finally, we have family history. If you're from a family where the people in your family have experienced this form of cancer quite often, or even two or three, you have greater chance of having this cancer. Then the cause of colon cancer, just like every other cancer, it's caused by mutation of the DNA in the gene. So just in the cells of the cells that line the walls of the large intestines, if the DNA of those genes in that cell is affected, it could lead to colon cancer. And normally cells divide and grow so that they could replace those wear and tear. So in terms of mutated gene, those cells continue dividing without stopping, and as they continue to divide and multiply, it leads to accumulation, and then it could result to tumor, and from the tumor it continues, and then it results to cancer. So for instance, there's a link between risk factors and causes. I told you risk factor doesn't mean you will definitely have cancer, but it could lead to that. So if we are using an instance of unhealthy diet, as I mentioned earlier, unhealthy diet could expose those cells of the large intestine to toxins, and those toxins could cause a mutation in the DNA of those cells in the large intestines, and that can result in cancer. So that's the link between risk factors and causes.
Symptoms of colon cancer include fullness or pain in the abdomen, fatigue, shortness of breath, weight loss, dark stools or blood in the stools, change in bowel habits such as diarrhea, narrow stools, or constipation, perforation or blockage of the colon and other nearby structures. Keep in mind that many of these problems can also be caused by other diseases, but in any case, a person should see a doctor if they experience any of these symptoms.
Now, you might want to know how colon cancer can be prevented. Colon cancer can be prevented using colonoscopy. Colonoscopy is the examination of the insides of the colon. It is the best procedure when colon cancer is being suspected. Although majority of the polyps that are removed using colonoscopes are benign, there are many precancerous polyps. Removal of these precancerous polyps prevents them from further developing into colon cancer in the future. Also, genetic testing can be used to detect hereditary colon cancer syndromes, thereby taking measures to prevent colon cancer. There are also some lifestyle modifications that will go a long way in preventing colon cancer, and this includes having diet that is high in fiber and low in fat, which is a diet that has lots of fruits, vegetables, and whole grains in them due to their high fiber content and the variety of nutrients that they have. Quitting smoking, and if alcohol must be taken, it has to be moderate. Maintaining a healthy weight and having regular physical activity. These measures will prevent colon cancer.
Finding colon cancer at its earlier stage provide the greatest chance of cure. So if your signs and symptoms indicate that you could have colon cancer, one or more tests may be recommended. Number one test is colonoscopy. This test makes use of a long, slender tube attached to a video camera to view the entire colon and rectum. Then if any suspicious area is found, the tube is used to collect sample of that area for proper analysis. The second one is carcinoembryonic antigen test. The carcinoembryonic antigen are chemicals that are sometimes produced by colon and rectal cancer cells. The tests are carried out to check for the level of this antigen in the blood. These tests also help to figure out the stage of the cancer and to find out if it has spread to other parts of the body. The test is also useful in monitoring the effectiveness of cancer treatment.
Most times when people talk of the treatment of cancer, they mostly consider the chemotherapy aspect of it, but there are other ways of treating cancer. Today we are going to focus on the treatment of colon cancer. Now, when treating a patient with colon cancer, we consider three things. First is the size, secondly is the location of the tumor, and then lastly we consider the rate of the spread of the tumor. So we have three methods of treating colon cancer. First is the surgical method, which is mostly used for stage 1 to stage 3 cancer. Now, the stage 1 to stage 3 cancer has to be localized, meaning it has to be in one part of the body. If it spreads, then we mostly use the second method, which is chemotherapy. Chemotherapy often involves the use of cytotoxic agents such as 5-fluorouracil and others. Now, lastly, we have the radiation therapy, which involves the use of radiation to eradicate the tumor. And this is mostly used for the rectum, for tumors that are caused at the rectal area, rectal region. Follow-up examinations are very crucial when there is a diagnosis of colorectal cancer. This is because this cancer has a tendency to spread to nearby organs, especially the lungs and the liver. Therefore, CT scans of the lungs, the liver, and the abdomen is usually important, and it's usually carried out when there is a diagnosis for colorectal cancer. The survival rate for cancer depends on a number of factors, but especially on the time when it was diagnosed, how early the cancer was when it was diagnosed. Studies have shown that for colorectal cancer, only about 39% are diagnosed at an early stage, which is really poor because it means that a lot of people do not go in for regular medical checkups. Regular medical checkups are important because problems are detected earlier and treatments are started earlier, which improves the survival rate of that particular disease. When colorectal cancer is diagnosed at an early stage, the 5-year survival rate for colorectal cancer is about 90% for those that were diagnosed at an early stage. But when the spread has already begun, the 5-year survival rate drops to about 71%. Now, for colorectal cancer that was diagnosed at a very late stage, let's say stage 4, now the 5-year survival rate drops to 14%, and this is because the cancer has already spread to further parts of the body. We all need to work together to prevent premature and heartbreaking deaths that occur from diseases like this. Remember that health is wealth, and your health is in your hands.